mastered then.
Okay. Well, we're here to talk about cerebral spinal fluid leaks. And cerebral spinal fluid leaks can be caused from many different things. They can be caused from head trauma. They can be caused from a sinus surgery. They can be caused from a spinal tap. And you have your spontaneous cerebral spinal fluid leak. Once you get diagnosed with a cerebral spinal fluid leak, you have several options and some not so many options to choose from. Today we are going to be having surgery on my cerebral spinal fluid leak. And you have the option, if you use a neurosurgeon, they will go in through the cranial area. Or if you use an ornithologist, he pretty much primarily takes the nasal approach. I have been diagnosed with a spontaneous rupture, so I've chosen the nasal approach. So the best thing that you could ever do is, once you get diagnosed with a cerebral spinal fluid, is to choose a really good doctor. The doctor that's doing my surgery, his name is Dr. Matthew Ryan, and he works out of UT Southwestern in Dallas, Texas. And he's a specialist in the field of all type of traumatic things that has to do with the ear, nose, and throat. It takes some time to get diagnosed because a lot of doctors, like your primary care doctor, your allergist, they kind of put off your complaints that your nose is running. So if you are having a nose run that is only running from one side and it's dripping out like water, you might want to get tested for a cerebral spinal fluid leak. And what they're going to do is take a sample of that's coming out your nose, and they have a test that they do to diagnose whether or not that's a cerebral spinal fluid leak or not. So be persistent when you're seeing your doctor. If your nose is running and it's pouring out like water, chances may be that you have a cerebral spinal fluid leak. So I'll check back in after my surgery and let you know how it went. Thank you.